Hi, I'm Unuksunuk Mater, and I'm a patient of Dr. Leonardo Capro, and I'm 53 years old. 23 years ago, I went from a lifetime of activity, gymnast, military service, runner, working with horses, dogs, and becoming a pro musher on the race circuit. And unfortunately, I flew off a cliff, landed on river ice, which then catapulted me into the world of chronic pain. The result of that accident, although it took several years for everything to culminate, was a fusion of L5-S1 with a titanium bone cages and graft for my right hip. My right hip's been reconstructed twice. I'm also fused at C4-5, C5-6, blown at C6-7 with no fusion. Severe nerve damage to the right leg. So lots of reasons I would have chronic pain. I tried all the traditional therapies for years and medications, and I remained super active. And I know sometimes that's unusual because chronic pain patients, and I understand why, give up almost everything in their lives, including their work. So in Alaska, they approached me. I had a spinal cord stimulator implanted for lumbar, which did improve my life for a handful of years. So much so at first that we decided to try me out as one of the first patients who ended up with dual spinal cord stimulators having a cervical implant, which was a gamble and it never worked the way we wanted it to. I finally just turned my systems off. Then I moved from Bush, Alaska to North Carolina, and lucky for me, the only doctor that would see me was Leonardo Capro at Carolina's Pain Institute, and his most excellent fellow, Dr. Janis Patel, talked to me about switching my technologies, my systems over to. I was pretty skeptical. I heard things like pain-free, and I thought, right, I've heard that many times in 23 years, and I don't believe it. But I looked into it. I decided to do it. I had my lumbar system replaced on May 10th. Then I had my cervical system replaced. If I'm really honest, after I woke up from surgery, and my back felt so much better, they had warned me it might take 24 hours for the technology to kick in. I was like, no, this is it. I'm getting a whole new life at 53. Not many people can say that, I guess. So I intend to pretend like I'm 20 or 25, and I am going to Mount Kilimanjaro. I'm training daily right now, doing my horses, my cattle, our farming, my regular housework, although I try to get out of it for other reasons than pain. Doesn't everybody? Sex is better. Roughhousing with the grandkids is better. Driving I can do without wanting to cry. Walking, standing for long periods. I work out on a mountain climber now on top of my physical therapy workouts. And I can't stop eating because I'm not bothered with cervical migraines of 30 and 40 days anymore that make me throw up. And I feel better, which makes it easier to be happier. And thanks, Dr. Capro.